Welcome back, you curious policy-loving campers. This is Medicare Tales and Marshmallows, where we spark up the real stories behind the health insurance alphabet soup and roast some strange policies over the open flames of common sense. Today, we're diving deeper into what Medicare doesn't cover, and you won't believe some of it. Yes, we're talking about the mysterious missing puzzle pieces in your Medicare box. Joining me once again, the encyclopedic, electric, and just a little bit dangerous with a dry erase marker, Dr. Connie A.
Pleasure to be back, Kem. I brought my trusted red pen and a bag of vintage Medicare regulations. We're going to make s'mores out of this mess. I also brought extra chocolate in case this episode gets dark.
Ooh, sounds ominous. And on that note, let's start with this vicious rumor I've heard. Why, in the name of Florence Nightingale, does Medicare not cover the first 3 pints of blood?
A great blood budget compromise of the 1960s. Picture this. Hospitals were using donated blood, budgets were tight, and lawmakers figured, let's skip the first 3 pints. People can bring their own.
And this isn't a typo? This isn't some intern falling asleep on the 1966 typewriter?
Nope, it's truly an official policy. I guess they assumed people would either donate blood, get it from a local bank, or bring a friend who'd spot 'em a pint.
So if I have a fencing accident, long story, don't ask, and need 4 pints?
You pay for 3. 4th one's on Uncle Sam.
I'm sorry, was there a vampire lobbyist we didn't know about?
If there was, he definitely was too young to be on Medicare. Seriously though, when Medicare was created, the budget was tight. Hospitals often relied on blood donations, and lawmakers figured, well, people can get a few pints for free, let's not pay for the first few.
Nothing says efficient healthcare system like BYOB, bring your own blood.
Exactly. And because Medicare laws don't update themselves, that odd little policy stuck. To this day, unless the blood comes from a free blood bank or donation from a friend or relative, you're on the hook for the first 3 pints. The 4th pint is Medicare covered, because apparently that's the one that pushes you into VIP territory.
Unreal.
Yup, this policy been making eyebrows raise and veins pop since the 60s. I once heard of a claim with a $900 charge just for 2 pints. That's $450 per pint, like a Cabernet from Napa, but less fun. Before we move on, can I squeeze in another bloody joke?
Sure, they do say laughter is the best medicine. Go for it, Dr. Connie.
This one is from one of my favorite comedians. I probably won't do it justice, but here we go. You ever read the fine print on original Medicare? Yeah, turns out they don't cover the first 3 pints of blood. 3! Like you show up at the hospital missing half your internal organs, and they're like, oh, yeah, we do blood, but only after you've spilled enough to star in a B horror movie.
Not bad, not bad. Hey, if you're listening and you've still got blood in your body, and I hope you do, just know that Medicare's got a weird relationship with the first few drops. Okay, I think we've bled that topic dry. Enough with the gory stuff. Can we talk teeth?
Ah, yes. Teeth, eyes, and ears. Who needs those? Original Medicare sees them as luxuries, apparently.
Because chewing and seeing are so overrated once you turn 65.
That's right. Routine dental, eye exams, hearing aids, all not covered. You want those? You're either paying out of pocket, getting separate plans, signing up for Medicare Advantage plan that includes them, or creatively solving with tweezers and prayer.
Oh boy. Moving right along, let's talk about dessert, specifically the Part D donut hole. You start out paying a copay, then bam, you fall into the abyss of coverage gap.
Well, there's good news on that front. Happy to report that the hole has been filled and is now officially a thing of the past.
Wow, that's awesome. Good to hear about positive changes when they occur.
Absolutely. But to be clear, original Medicare does not cover prescription drugs. That's always been only available through private insurance, and that part hasn't changed. It's the cost gap that existed even with the private insurance that got fixed.
So let's see if I have this right. With original Medicare, first 3 pints you're out of pocket, no teeth, no help, losing your hearing, good luck, need to check your vision, good night, need prescription drugs, get in line for a private plan.
Bingo. And you missed a couple others, like number 1, long-term care is not covered at all. I repeat, not covered. No assisted living home stays just for the fun of it, no help bathing or dressing long-term. Coverage only applies to medically necessary services, not day-to-day general living assistance.
This is starting to sound like one of those cooking shows where you only get half the ingredients and a blindfold.
Yes, and that's why people find ways to fill the gaps.
Okay, before we get to self-help options, Dr. Connie, if you could patch just one Medicare coverage gap with a magic marshmallow wand, which one would it be?
Oh, tough one. But I'd start with dental. You can't manage diabetes, heart disease, or nutrition without your mouth, and yet Medicare treats molars like they're optional accessories.
Not to beat a dead horse, but if your teeth fall out, you go deaf, and need glasses, you're basically invisible to Medicare. Invisible and unfunded. Unless you've got additional insurance or a winning lottery ticket, you're filling those gaps 100% out of pocket. Alrighty then, speaking of pockets, can we talk specifically about cost gaps with Original Medicare? Does Medicare pay all costs as long as the service is covered?
That's a trick question, right? Nope. Much like private insurance, Original Medicare also has cost sharing, which include deductibles, co-insurance, and copays. We don't have enough time to get into the specifics, but listeners can find the gory details on Medicare.gov.
Oh, come now, Doc. Don't leave us hanging. At least give us some examples.
Okay, let's see. How about the fact that for some covered services, Medicare pays 80%, you pay 20%, aka co-insurance. Need to be admitted to a hospital? You'll have to pay some deductibles before Original Medicare kicks in. And oh, there's no maximum out-of-pocket with Original Medicare, so these costs can really add up. There's a notable example of a family who reported receiving a Medicare summary suggesting a potential cost of $1.8 million for a hospital ICU stay.
Wow, sounds like we need a whole separate episode on costs. For now, let's go over self-help coping mechanisms. What are the available options for folks looking to fill both the care and cost gaps?
Basically, there are 3 main strategies in no particular order of priority. Number 1, buy a Medigap or supplement plan. This pairs with Original Medicare and helps with cost gaps like deductibles, copays, co-insurance. It does not cover care gaps or extra benefits like hearing aids, routine vision, dental, or drugs, but it gives predictable costs. Number 2, choose a Medicare Advantage plan. This replaces Original Medicare and addresses coverage gaps by bundling extra benefits like hearing aids, routine vision, dental, and even an embedded prescription drug plan option. Some plans also offer perks like gym membership, transportation to appointments, help with healthy groceries, etc. But they don't address cost gaps, so you'll still have deductibles, co-insurance, and copays. Thirdly, get other insurance. Low-income individuals may qualify for Medicaid to help cover gaps in Original Medicare. Veterans or service members can leverage additional federal government programs, and some employers provide retiree health insurance plans. Oh, I guess technically there's a 4th. Do nothing, stick with Original Medicare, and pay out of pocket for everything Medicare doesn't cover.
Right.
I do not recommend that option.
Hold up, why not just combine Medigap and Medicare Advantage? Sounds like those two cover all the gaps, right? Both cost and coverage gaps? What am I missing?
Not so fast. Turns out you can't combine these. Sorry.
Knew that was too good to be true. Okay, how about the long-term care gap? Which of these options address that?
Alas, the short answer is none. Well, unless you qualify for Medicaid, which again is based on state-specific income thresholds, there's also separate long-term care insurance, which is pretty expensive and hard to get after a certain age. The sad reality is that reliance on family caregivers is a growing silent epidemic of unpaid labor. Or as one woman once told me, I'm hoping for excellent karma and a nurse for a daughter.
So, the dream is age age in place with dignity, but the reality is start saving yesterday and buy your kids thank you cards in advance now.
That sums it up pretty well.
This is all rather depressing, but you mentioned options for people with lower incomes. Good news on that front, there are help programs. Things like Medicare savings programs, help with premiums, deductibles, extra help for prescription drug costs, PACE programs in some areas, coordinated care for frail seniors. Just a word of caution, navigating these options can feel like filling out taxes during a tornado. But of course, final thoughts, Connie?
Be sure to know what Medicare covers and what it doesn't before you need it. Plan ahead, compare options, and please ask for help. Don't go it alone, even if you have a doctorate, a spreadsheet, and a major degree in patience. Use free support resources by contacting Medicare.gov, provides free resources and professionals available to talk or chat with you about Medicare. State Health Insurance Assistance Program provides free counselors and informational sessions. Trusted licensed broker. Find one that specializes in Medicare. All services are provided at no cost to you. It's not about fear, it's about planning. The fewer surprises, the better your health and your wallet will be.
Well said, Connie. Well said. And friends, always remember, if you're gonna bleed, do it 4 pints or more.
And bring a friend who's willing to donate the first 3 pints. That's what friends are for.
As always, you have been a wealth of information. Well, that's all we have time for today, folks. Until next time, stay warm and check your blood type and coverage options.